When it comes to taking care of our health, we hope, though, our children will follow all the things that they need to stay healthy, but more than anything, we hope that they never have to have surgery. However, if they do, Providence Swedish goes to great lengths to make sure families feel comfortable while they're at the hospital. Now, here to tell us more about how and what they do is pediatric surgeon Dr. Rob Weinsheimer from Providence Swedish. Thank you for being here.
Oh, thanks for having me.
So before I get into many of the questions, I wanted to ask, what are the most common types of surgeries you perform on children?
Yeah, so I'm a general pediatric and thoracic surgeon. So that basically means we do a really wide variety of surgery. And the most common things emergently would be appendectomies, so children with abdominal pain due to appendicitis.
Oh,
so that's number one for sure for children coming in through the emergency department.
Okay.
And then for things that are more elective, that are kind of planned and scheduled, hernias would be the most common, but there's a broad range of things, from chest wall abnormalities to lumps and bumps to kind of you name it. So it's really broad, which is part of the rewarding part of the specialty.
To tonsil surgery, right?
Yeah, exactly,
I was
exactly.
mentioning that earlier.
Yeah.
But I'm excited that you actually brought some things with you, some sort of surgical instruments. What is all this, and what is it used for?
Yeah, so one of the exciting parts of the evolution of surgery has been a focus on really trying to decrease how invasive surgery is, right? And when it get down to it, it means trying to keep incisions really small so you don't have big scars. And not only is that great, from an appearance standpoint, but more importantly, it helps children heal faster.
Oh, yeah.
And so that means less pain, getting back to all your activities faster. So, lots of our older kids and teenagers are just really want to get back on that soccer field.
Oh, yeah.
And this is one of the keys to do it.
So what is this? And,
yes.
and they just, I don't want to touch it.
Yes,
but
no,
you can.
So you won't break it, yeah.
What are they? Are they just like tiny instruments and tools?
Yes, so a lot of surgery is done open, which is the traditional larger incision.
Yeah.
And then using tools in your hands and directly manipulating tissue. And then this is a technology called laparoscopic surgery.
Oh.
And yeah, I can show you what these instruments look like. And the cool thing is these instruments are designed specifically for children. And so when we have adult size instruments, they're 3 times as large, which means 3 times as large an incision. So these go through these little sort of straws, which are called trocars. And so the instrument goes through, and then we can manipulate. So this is at the level of the skin. The tip of the instrument's now the inside. And then we can do our surgery with usually at least 3 of these. So a camera through one, and then some instruments through the others. And so that what is amazing is the size of the incision then is just the diameter of that, which is just over 3 millimeters.
This is incredible to see. I can't even believe just how far technology has advanced and how wonderful it is that children have been thought of, especially in this manner. I imagine, though, that going into surgery, going to the hospital could be a scary place for kids. What does Providence Swedish do to make that hospital experience less intimidating for kids overall?
Yeah, so that is a huge thing. And we have clearly the patient, but we also have parents, right? And parents are feeling really stressed in this moment. And as much as we try and preempt that and ahead of time kind of go through the experience with parents and the child, at the day of surgery, we really have a team approach that is really focused on having kids relax and be calm and be stress-free. And so the very first person that they meet is a child life specialist. And I know Dr. Mead talked about that a little bit. And they are wonderful. So they really make the experience from walking into the doors to the hospital to going home a fun experience.
And I'm looking at some of the images that we have here, and there was a teddy bear with a mask on, just kind of letting kids know that, making it safe for them, right?
Yeah, so pretty much every time a child is having surgery, a stuffy is part of the experience, and it's great to just walk through, okay, here's a mask that goes on.
Yeah.
They get to pick out some great smells that they put on the mask that, is
neat.
lemonade or whatever flavor they want.
That's so clever.
So it's really fun. Yeah, they have a good time.
As a general surgeon, though, I imagine collaborating with your colleagues is important, that the pediatric, physician. Talk to me about how you work with your pediatric specialty care colleagues at Swedish.
Yeah, so that is a huge part of it. And that's honestly one of the best things about my job is I love the people I work with. And our specialty office is set up in a way that a family can come in and they can see a pediatric GI doctor and then stay right in the same room, and then myself or one of my two pediatric surgery colleagues will come in and see them for an issue that involves both medical care and potentially surgical care. So it's really collaborative. It's a kind of a very close-knit group, so it makes it really fun.
It makes all the difference. It really, really does. Thank you so much. It's been a pleasure chatting with you. Thank you for showing us these incredible instruments and what you do for kids every day. Thank you.
Yeah, you're so welcome.
All right, to learn more about the pediatric surgical options Providence Swedish has to offer, just visit the website you see right there on your screen.
This portion of New Day Northwest is sponsored by Providence Swedish.